words. Thank you, everybody, for making time for this conversation. What I thought I'd do is just start with a description of what we're trying to achieve, a little bit about the context first, and then lots of time for questions. I want to introduce our Senior Vice Chancellor for Health and Hospitals, Val Gray, who joined me and has been working 24 hours a day on this issue for quite some time. So let me start with the context. And Chairman McCall and Reverend Kohal referenced this a minute ago. SUNY Downstate is a tremendously important institution for the community. It's a tremendously important institution within SUNY. The role of Downstate Health Sciences University in producing a diverse healthcare workforce is critical. SUNY Downstate graduates not only are diverse, but they are committed to New York. You look at the other medical schools in New York City, when their students graduate, they leave. When Downstate students graduate, they stay in the community and serve in the community. Downstate is one of the largest providers of doctors for New York City. So one of our top priorities is to make sure that we do everything we can to protect and strengthen the Health Sciences University. Second piece of context is, Chairman McCall references, the hospital is struggling financially. There are a lot of reasons for that, and all of you know that is a long-standing problem. That is not a recent development. But the financial struggles are tied to several factors. One is a general shift in healthcare towards outpatient services. Right? So years ago, folks would stay in the hospital much longer. And there are many treatments that you get now that you are in and out in a day and back home, where you used to have to stay multiple days in the hospital. That shift means throughout the country we are seeing that hospitals are needing to reimagine themselves to move from inpatient services to more outpatient services. That's one of the challenges. A second challenge is that the population that we serve at SUNY Downstate oftentimes is reliant on Medicaid. And as a country, we have not invested enough in supporting the health needs of folks who are on Medicaid. That's just the reality. Third challenge is that this problem has been so long-standing and without action that we've come to financial crossroads. We will have this year a $100 million deficit, and we will run out of cash by the summer. And so last year, I started in January. Last year, I spent a lot of time talking with members of the Brooklyn delegation and legislators about the need for resources at Downstate to avoid running out of resources. We got very limited additional resources last year. And so now, facing this $100 million deficit, we will run out of cash by the summer. Third piece of context is the building. And many of you who've been in the building know, if you know folks who work in the building has been without capital investment for a very long time. There is flooding regularly in the building, significant temperature control issues, a HVAC system that is very vulnerable. And so the building itself is vulnerable to catastrophic failure. Harm to patients, harm to staff, or something like the HVAC, the heating and the air conditioning. If that breaks down, you have to shut down services. So the condition of the building has to be addressed, and that is not something that can be put off. So that's the context, both the financial challenges and the challenges in the building, but wanting to do everything we can to preserve the strength of the Health Sciences University and protect the health services for the community. So, given that we didn't get significant additional resources last year from the legislature, the question was, how do we possibly move forward? And I want to be very clear. This is not a plan about closing Downstate Hospital. This is a plan that's really about how do you save the hospital, improve services to the community, and protect the Health Sciences University. And I give Governor Hochul tremendous credit for being willing to step up with significant resources in a way that prior governors have not. So the plan that we've been in discussion with the governor's office about and that we want feedback on has 4 parts, and I'll walk through each of them. The first is the governor is willing to invest $300 million in capital funds into Downstate. That's the largest investment of capital dollars in Downstate in many years. That $300 million would allow us to build a new outpatient facility. So a facility that provides urgent care, ambulatory surgery, provides primary care services. It would also allow us to build space for a health disparities institute. We have federal funding at Downstate to address issues of health disparities. We want to make that a nationally renowned, world-renowned institute, and so this $300 million will help us build space for that Health Disparities Institute. And the $300 million will allow us to, in that same building, create space for academic services and support services for students of the Health Sciences University. So $300 million new building that would be built essentially across the street from the current main hospital building. Second part of the plan. SUNY Downstate Hospital has multiple buildings, but the bulk of the services are provided in the University Hospital building, the main building. That's the building that is in disrepair. That is a building that we need to address. To replace that building or to renovate it in order for it to be a world-class hospital would be $3 to $4 billion. And we don't have $3 to $4 billion at SUNY. The state is in a tough budget year, so we don't see a place to get the $3 to $4 billion to build a new hospital. And to be clear, to build a new hospital would be an 8 to 10 year project, and the current building is in need of intervention. We cannot do 8 to 10 more years in the current building as it stands. I was talking to a doctor a couple of weeks ago from Downstate who was pointing out that in cold the last few days, and told me she was worried that the pipes were going to burst again, and she was going to end services in her portion of the hospital. So those are the stakes on the facility. So the second part of the plan is to relocate the inpatient services that are now provided in the University Hospital building across the street to a SUNY Downstate wing of Kings County. Now, Kings County has space that's not currently in use, some space that they've mothballed essentially, some ways they would reconfigure their space to create a space that would have a separate SUNY Downstate identity. It would be SUNY Downstate doctors, it would be SUNY Downstate staff that would be providing services across the street from where the services are provided now. Now, as a result of being in that Kings County space, we'd be able to share some services with Kings County. That's something that already happens to some degree. As Reverend Cohon knows, we have many doctors, many specialists who work on both sides of the street at both Kings County and Downstate. There's a lot of collaboration already. So in this relocation, there'll be an opportunity to increase the shared services and enhance the services that are provided to the community, again, by SUNY Downstate doctors and staff in this SUNY Downstate wing. There are some services that wouldn't make sense to site in that SUNY Downstate wing. We work very closely, for example, with Maimonides. Many of our doctors also work at Maimonides. Many of our residents are placed at Maimonides or Kings County. Actually, 2/3 of our residents and clerkships, our residencies and clerkships are at other hospitals, not at the University Hospital building. So we provide some of the services through those partnerships. But I want to be clear, and I hope you will help us to convey this, because I do think there's a lot of misinformation. All the services that are provided and all the inpatient services will be continued. Some at the SUNY Downstate wing of Kings County, potentially others at some of our other partner hospitals. But every service, I know there's been questions about the kidney transplant service, for example. We are 100% committed to continuing the kidney transplant service and to making sure it is available here in Brooklyn. So I want to be clear on that. Third part of the plan is that the governor is willing to absorb the deficits during the transition period. This is critical because, as I explained, we are going to run out of cash by the summer. The governor is willing, because we put forward a plan that gets us to financial sustainability, she is willing to cover the deficit for this year, $100 million, and for next year, likely another $100 million. Again, this is the largest investment that a governor has been willing to make in SUNY Downstate in a very, very long time. Fourth part of the plan is that the governor really is committed to our vision of this Health Disparities Institute and improving primary care and outpatient services, and is willing to commit to continuing operating funding every year to help support the Health Disparities Institute and the outpatient services, somewhere around $20 million a year, in addition to the $200 million in operating support to cover the deficits and the $300 million in capital investment. Again, largest investment that's been made in Downstate in likely in decades. Those are the core elements of the plan. A couple important points. I know there are a lot of concerns about the employees, and that's understandable. Let me describe. There are all the employees of Health Sciences University. Health Sciences University will continue and will be able to expand, actually, activities with the new Academic and Student Support Services Center and with the Health Disparities Institute. So everyone who's working at the Health Sciences University, their roles continue. For the hospital, there are essentially four unions at the hospital: CSEA, PAF, NYSCOBA, and UUP. All of the CSEA and PAF and NYSCOBA employees would have roles either at the SUNY Downstate wing of Kings County or at one of our other SUNY Downstate sites where we operate. Like there's a Bay Ridge facility, for example. So all of the folks who have roles in those three unions all will have roles in the continuing SUNY Downstate. UUP, almost all of their employees would have roles in the new SUNY Downstate, but not all. So they would have a 10 to 20% reduction in their numbers. Now it's important to describe sort of why that is. Some of those folks are doctors who right now teach half-time, let's say, at the Health Sciences University and work half-time in the university hospital building. For some services that might move to another partner hospital, it might make more sense for that doctor to continue to teach at Downstate Health Sciences University, but to change their affiliation from Downstate to Kings County or Maimonides. So that's a portion of that lost number for UUP. Another portion is that because we'll be in the same space, in the same larger space with Kings County, there'll be opportunities to share services. We won't replicate every lab, for example, that exists at Kings County in the SUNY Downstate wing. So there'll be roles for a lot of folks, but there may not be roles for every person. So that's why we don't have an exact number, but it'll be about 10 to 20% reduction for UUP. I realize that is hard, that is disruptive. It is, to my mind, much less disruptive than everyone being without a role. If we get to the summer without enough cash to continue to operate, it is much less disruptive than having to shut down services in all or part of the building because of a failure of the heating and ventilation system. So we're trying to manage the situation in a way that minimizes the disruption. Now, we have other hospitals at SUNY. We have Stony Brook and Upstate. We're in the midst of a healthcare workforce shortage as a state. If folks move to one of those other hospitals, they would continue to be UUP members. But if folks want to stay local and do not have a role at the SUNY Downstate wing of Kings County, given the healthcare workforce shortage, we are confident that we can work with folks to make sure that they find a placement. Again, I understand that for UUP, it means a loss in their membership numbers. I appreciate that. But what we're trying to do is make sure that we serve the community as well as possible, support the staff as best as we can within the resources that are available, and strengthen the health sciences university. The other question that comes up often is what happens to the existing building after the inpatient services move to the SUNY Downstate wing of Kings County. The timeline for that will depend in part on how quickly we can build a new outpatient facility. Right, so that'll be a new building. We'll move outpatient services from the current building to that new building. So it may take some time to get that building built. And during that time, we'll continue to provide the outpatient services in the university hospital building as long as we can. But long term, once the services move to the new facility and to the SUNY Downstate wing of Kings County, there'll be a question of how is that old building used? And that is one of the reasons we want to have a robust community engagement process. I've certainly heard from a lot of folks already enthusiasm about the potential for housing, for affordable housing for folks who work at either the hospital or the health sciences university. I've heard a lot of interest in a wellness center or a fitness facility like a YMCA coming to the community. But that is all to be determined based on the community input that we receive. So let me turn to questions, but I'll just close by making this point. Look, I am trying to find a way forward within the resources that are available. I understand there are folks who are going to say, well, we should just build a new $3-4 billion hospital. But the reality is, those are not resources we have at SUNY. And when you look at the state budget process this year, it is very clear to me that there's not $3-4 billion for a new hospital building. So within the resources we have, with the governor's generous support, $300 million in capital, $200 million in covering the deficits, $20 million a year in operating support, we're trying to find the best path forward. And for me personally, I have to say, I'm sharing with Reverend Cohon. I grew up not far from here. I grew up in Flatlands. I know this community well. My mom, when I was 8 years old, passed away at Kings County. For my whole life, when the word hospital is said, I think of that moment standing by her hospital room at Kings County when I was 8 years old. So I just want to underscore this is a community that is very important to me, and so I want to share that that's part of the spirit in which I come to this, trying to make sure we do right by the staff, by the community, and by our students. So with that, let me see if there are questions. Yes, sir.
So, good afternoon, everyone. Dr. King, thank you for your presentation. Chairman McCall, thank you. Reverend Cole, thank you for hosting us. These folks here, in 2013, we were part of the coalition to save SUNY Downstate. We were recruited by Rowena, who was a chapter president, and we formed in and saved Downstate. I appreciate your presentation because information is powerful. We feel as though this is thrown at us with no prior knowledge, no negotiation, nothing at all. And so we came here not sure if we came to negotiate or we came to fight. because, you know, again, we're just hearing it for the first time, so we appreciate it. I want to say that let me again thank the Lord, thank God for Chairman McCall, because 11 years ago he was a chairman of the SUNY Board of Trustees. We made it over and over, and the SUNY Board of Trustees provided a lot of resources. I do want to say this. Downstate have had financial challenges for a while, but this last one, we have to admit, the state of New York designated SUNY Downstate as a COVID-only hospital. Because of that, there was no surgery, nothing happened. So the way we see it, the state created this last budget, this $100 million. And so for the state to create it, and then the state not willing to bail the hospital out is a slap in all of our faces. So I had to say that. Now on your plan, it sounds good, but for us, I think we have to form coalitions and committees. We have always worked with the union, we work with PIF and UUP and CSEA, and we want to be involved and informed every step of the way. If this is a done deal, if it's a done deal, then make us a part of it. If it's not a done deal, or is there an alternative? I'm talking about if it's not a done deal. $300 million, we appreciate the governor. The budget of the state is $233 billion. So this is a drop in the bucket. So I'm not gonna, I celebrate her, but I'm not gonna celebrate too much because I know that the state have a lot of money. It's where the will is where our state legislators are. And we're gonna meet with the state legislators as a group because they have to, at the end of the day, the legislators control the purse, so they can put money into the state budget. So I don't want to fight with you, but I want you to work with us. Smart people in this room, we're committed to SUNY Downstate, and just keep us informed so that we can work as a partnership.
Thank you. Look, I'm 100% committed to community engagement process in the weeks ahead about each of the pieces. And we're going to do a community-wide survey. We're going to organize meetings about the future use of the building, about inpatient services, and about the outpatient services. Because we want to make sure that the design of all three of those pieces reflects community input. So, this is the start of the process. The governor committed in her executive budget to the resources to start this process. What I would say in terms of the path forward is the alternative that has been presented up till now is a $3 to $4 billion new hospital. And if you look at the service area that is served by SUNY Downstate, there are 1,600 beds available in this service area, in the hospitals in this service area, 700 that are in regular use. So that makes the issue of saying we should build a brand new facility much harder as an argument. But there are areas of need. There was just a health equity report that the Department of Health produced. There are areas of significant need, particularly around primary care, outpatient services. There's a deep interest that we have in trying to tackle maternal health disparities. That could be an area of real focus for the Health Disparities Institute. We have a midwives program that will have, I think, 50 graduates this year. So we want to invest in that. At the same time, SUNY Downstate on a day-to-day basis does less than 2 births a day. So the current SUNY Downstate doesn't have the capacity to respond. But we think that the new vision with this Health Disparities Institute will have much more capacity to respond to the challenges. I think we have someone in Cunningham on Zoom somehow. Is that right? We're working on it. Oh, okay. We'll come back. Yes, sir.
Yeah, sorry. We heard of some of the proposals in the YMCA, housing, if that were to go by, the only thing we would accept is a women's and children's hospital based on the infant and maternal mortality crisis that we are having. All right, we having this in New York, but Flatbush, East Flatbush is the epicenter of this crisis. And that is great relief. You can convince the feds they want to deal with that to get that $3 billion to focus on women and children hospital. All right, we're not going to accept anything else. No YMCA.
I appreciate that. That is, that's not something I control. I can only work with the resources I have, and look, and that Women's and Children's Hospital would be a different hospital, right? It would be a different staff, it would be a different service mix. That is not the set of services that are provided today in SUNY Downstate. So all the questions, where do the SUNY Downstate services go? How are the outpatient service needs met? All those questions would still exist, even if that new hospital were to be built. Yes, ma'am.
Yes. So I just want to get a little bit more clarity. You mentioned having a new outpatient building, and you said across the street. So are you referring to replacing the garage that's supposed to be coming down? And now, so it would be a separate building that says Downstate that would be outpatient services.
Yeah.
And then the inpatient services at Kings County, has discussion already been had in Kings County and agreements made saying that this is supposed to happen for inpatient services and moving there. And then how do we make the distinction for the community to know that we still exist? Because if we're in Kings County, it's going to look like Kings County. And it's going to look as if once our building comes down, that SUNY Downstate no longer exists. They'll just see maybe a smaller version of us in the replacement of the garage. But if we're inside of Kings County, we've lost our identity. So what happens then?
Look, our conversations with the hospitals about the format of Kings County is that we would have a separate SUNY Downstate wing. And again, it would be SUNY Downstate doctors and SUNY Downstate staff. The exact services that would be provided at SUNY Downstate wing versus the services that would be provided at Kings County. That's some of the work that we have to do in the weeks ahead to make sure that we are increasing the services to the community. Now, the outpatient facility will be a SUNY Downstate outpatient facility with also space in that same building for the Health Disparities Institute and academic and student services space for the Health Sciences University.
But will our name be in conjunction with Kings County on the outside of the building? Or will you only know us being inside once you get inside of Kings County?
I'd say we haven't talked through that question precisely, but my expectation is there would be signage that would reflect that it is SUNY Downstate, that it would be SUNY Downstate doctors, SUNY Downstate staff providing SUNY Downstate services.
Hello, I'm Aditha Abraham Nichols. I'm chapter president for UPP, but I'm also a member of this community. I have a couple of things to say. Number one, I listened to the state of state, and they said there was $6.6 billion federal money dedicated to health care. Why can't Downstate get a new hospital? Number two, Kingsbrook just closed, and now you're trying to take Downstate away. I feel as if the state is abandoning the people of Brooklyn because of our color. You have the two other hospitals that are always funded, and Downstate never gets funded. We were COVID only, nothing was replaced. I was the nurse manager in the ED during COVID, and we got no help from the state of New York. How can you take away our hospital and talk about 10 to 20% reduction in UUP staff? I am a member of this community. When I don't work, 20 other people, mouths don't get fed. This is very unfair. There should be maybe some restructuring, but Downstate has a place in this community, and we are going to fight to keep it in this community. We are not happy with outpatient services alone. There are different things that are coming up, such as long COVID, people from 9/11 that are now coming in. We demand a hospital in this area, and we demand that
I agree. I can't change what's happened over the last 2 decades, the lack of investment. What I can do is, with the resources that are available, try to protect staff as best we can and maximize services to the community. So that's what I'm trying to do. And I've said to the statewide UP leadership, I'll say the same thing to you, which is, I'm very eager, our whole team is eager to sit down, talk person by person, and try to figure out how we make sure that we minimize the impact on staff. We are eager to sit down and talk through how we would manage the transition of the inpatient services across the street. We are eager to talk through what the outpatient service mix should be. Like, everything you said, I'm with you.
But I want a hospital,
Okay.
no outpatient services. We need a hospital. Kingsbrook just closed. Kings County is overwhelmed. Last week in the ED, people were there for 3 days without beds upstairs. And that's because of the commitment of the state of New York to not fixing the facility. We need a hospital, and that's what we're saying. No outpatient, we need a hospital.
But again, I agree with you. The inpatient services will happen in the SUNY Downstate wing of Kings County. I understand it is a different building. There are other SUNY Downstate buildings. Not all the services today are provided in the University Hospital building. I can't create a new $3-4 billion building on my own. But what I what's that?
Why can't we not have the funding?
Yes.
The storm happened 2 weeks from now, right?
Yeah.
The governor would move mountains and get the money for it.
Yes.
This is it. We have a problem here. Why can't we get the funding?
So there are 2 reasons I would say. One is the state fiscal environment. The state came into this year with a significant budget deficit. And what you see across state agencies is there weren't major new resources because of trying to address that deficit. And $3 to $4 billion is a very large commitment. That's one reason. The second reason is, if you look at the service area, as I mentioned earlier, there are 1,600 inpatient beds now, but only 700 in regular use. And so there's a lot of capacity, inpatient capacity now, and where there's the least capacity is on the outpatient primary care side. So I understand the desire to have a new hospital. I cannot deliver a $3-4 billion hospital. The question for us at SUNY is, with the $500 million investment, $300 million capital, $200 million operated, what are the things that we can do over the next 2 years to get to financial stability while maximizing services for the people? And that's what we're trying to do.
Hi, my name is Dr. Ramon Guest, the Service Director for Pediatric Clinical Care at Downstate. I want to talk back to this point about women and children's health. I know for a fact that right now I have a full ICU for pediatric patients at SUNY Downstate, as does Kings County. So I want to push back a bit about the point that we don't provide those services necessarily at SUNY Downstate. We have a NICU, we have an OB service, and we have a pediatric floor. I can tell you for a fact that if those patients were to have to go to Kings County, they cannot absorb that. So again, what is the plan for women and children's health? We focus so much at SUNY Downstate around maternal health disparities. And so in my estimation, if we close this hospital, we're gonna make it worse. And so there has to be a plan specifically around women and children's health. Because I can tell you right now, Kings County cannot absorb that. My mommies can't absorb that volume either. Clinton Hospital has no ICU for neonatal patients or pediatric patients. So for the people of Central Brooklyn, I grew up in this neighborhood too, 31st of Beverly. So what can you tell to our community of women and children who need health care here, where they're gonna go?
So just to be clear, and I appreciate that, I've been to the NICU, I appreciate that those services are provided. My point was just that the vision that people have offered of a new 90-bed, 100-bed women and children's hospital, that is a different hospital than the hospital that we are today. That was my point. But in terms of the service, let me get to your core point. All of the sure they are represented either in the SUNY Downstate wing of Kings County or with another partner hospital. So this is about facilities. We're not talking about any reduction. I can't emphasize this enough. We're not talking about any reduction in inpatient services.
But how would that work with this, or the same facilities already at Kings County? They have a pediatric ICU, they have a NICU. How would that actually work? What are the details
Yes.
of that?
And
we
that
need
is-
to talk together.
Yes, so I would love for you to help us in that conversation. That is exactly the work, and this is the work that Val has a team supported. The work over the next weeks and months is to lay out exactly how the services should be sited. Are they in a shared space? Are they separate spaces? Service by service, whether it's labs or particular areas of medical service. But let me be clear, there will be no reduction in inpatient services. That's our commitment. That's our commitment at SUNY. That's the commitment that the community of hospitals have made together to make sure that all of the inpatient services are represented. And in many cases, it will be the same SUNY doctor, the same SUNY staff providing the same service across the street. But not in every case.
From our standpoint, I just can't see what that looks like. You know, when there's a 7-bed ICU at Kings County that is routinely full, our ICU is full to 80% capacity routinely, right? Especially in this winter season when there's an epidemic of RSV, flu, right, enterovirus, all coming together. And so the double 150 beds of what services, right? And these can't be in isolation because things have to work together.
Exactly.
You know?
Exactly. Again, I agree completely, and I'll make to you the same offer that I made to the UVP statewide leadership. We want to be in conversation at that level of detail, service by service, bed by bed, to figure out exactly how we make sure not only that all the inpatient services are preserved, but that there are more. Right, but again, this goes back to, we've got a $100 million deficit and a building that cannot be maintained long-term, right? I think you'd agree with that, right? So that's our challenge that we're trying to solve. I would love to solve it together. We'd love to have more folks from you in the conversation. But the statewide leadership has taken the position so far. They won't talk about an alternative to the $3-4 billion new hospital, which is a thing that I can't deliver. Oh, I see.
Chancellor King, first of all, thank you so much, and Chairman McCall for coming to the room this evening.